hunting for meals. So thank you for being patient.
The burden of disease in developing countries has an impact on their growth and development, and without adequate research, finding lasting solutions can be difficult. This was part of Health Minister Dr. Jane Ruth Aceng's address to guests including health experts, researchers and beneficiaries of International Center for Child Health and Development, ICHAD.
Few African scholars on the continent are able to compete for extramural funding for their research program, primarily due to lack of infrastructure to develop research projects and lack of investments in training the next generation of investigators. Against that backdrop, there is a need to build research capacity addressing health disparities affecting children, adolescents, and their families.
Dr. Aceng said that emerging and re-emerging infectious diseases aggravate the existing disease burden and other societal problems like poverty.
There is also a growing burden of non-communicable diseases such as diabetes, mental health issues, and cancer, including non-communicable diseases in children. Importantly, factors leading to health disparities in sub-Saharan Africa, like weak healthcare systems, including inadequate research, surveillance and laboratory capacity, scarcity of public health human resources, and limited financial means have been further aggravated by the increasing burden of the emerging and re-emerging infectious diseases.
The founder of ICHAD, Professor Fred Sewamala, says their intervention has seen an addition of at least 100 researchers, some at PhD level, whom he says are what the developing world needs.
10 years ago, we didn't have these training programs. 10 years ago, I didn't have over 100 young scholars, PhDs and masters, trained on research. 10 years ago, I didn't have over 20 NIH-funded studies which are located within communities. But we see that 10 years ago, I didn't have co-investigators who are now giving me a chance for me even to pull back.
Under ICHAD, Sewamala says they have community interventions that target empowering the disadvantaged youths to attain an education through a savings scheme.
We started with 97. We have reached over 70,000 people in the Greater Masaka region. When we started, our focus was on building an infrastructure. We have 3 offices in Masaka. We have 1 office in Kampala. We have now an office in Yumbe and an office in Arua being opened up. And these offices are all focused on economic strengthening. In Arua and in Yumbe, economic strengthening of refugee families.
Walter Mwesije, NTV.